Welcome to Savvy Survivor. We're a place for information and inspiration for those who've completed cancer treatment and those who are living with cancer, oncology providers, as well as caregivers. Today's guest is Craig Peterson, who is a naturopath, and I'm going to let him tell you about himself and his connection and experience with cancer survivorship.
Hi, thanks for having me on, Meredith. So like you said, my name is Dr. Craig Peterson. I'm a naturopathic doctor. I also have a Master's of Science in Acupuncture, and I'm board certified in what's called Naturopathic Oncology. I currently teach at Bastyr University. I'm an adjunct faculty here, both teaching oncology, the didactic course, as well as I supervise students at the university here in Seattle on a teaching shift. And I have a private practice within the university and one of the other institutions here outside in the city as well. So thanks for having me, and I'm glad to provide any type of information that I can have regarding what I do and how I do what I do.
Great. So tell us about your work with people who've completed treatment or who are living with metastatic disease.
Yeah, I think it's a big part of where naturopathic medicine or naturopathy can fit in with patients in regard to their plan and their treatment. So with that being said, one of the things that I like to focus on after treatment is a lot of times patients will come and see me and say, hey, my oncologist said that I just have to get scans every 3 months and kind of just do this, that, or the other thing, and we'll just continue to monitor. And I think that's a great opportunity and a great area for us as naturopaths to be able to come in and help support patients with recovery from treatment, number one. So those things can include supporting the immune system or just, looking at some other types of interventions from the diet and lifestyle modifications to help people support their nutritional status as they go through recovery. I think that's one of the pieces that we can do a big part in. Another aspect of what I do is also looking at what is quoted in the literature as called chemopreventative strategies. Now that's a big word. So really what it comes down to in the literature is looking at, are there anything that can help prevent the risk of recurrence? And so what I try to do is look at that literature, to look at the mechanisms of action between any of the natural things that I may have, anything from botanical and herbal medicine to nutrients to even to the diet and lifestyle modifications that have been shown to be helpful for patients to decrease their risk of recurrence. So I think it's a very big area and a big part of what I do with my patients after treatment to help support them in their recovery and survivorship as well as remission.
Great. That's so important to all of us.
I agree.
How would you recommend people find a naturopath? Is it something that their oncologist might refer them to, or?
Yeah, potentially. I don't think that's necessarily the go-to source. And a lot of times, it's not that oncologists are necessarily opposed to this. It's just that they might have a difficult time having someone in the community that they have a relationship with. So there are a few resources that patients can start with. The first place you always want to start with is something called the American Association of Naturopathic Physicians. So it's just a large body that naturopaths will become members of course, after they've graduated from an accredited school. Now, that's an important piece. In the United States, you have to make sure that, as well as Canada, that students or practitioners have graduated from from a school that has been accredited by the government and is certified to give naturopathic doctorate degrees. So that's an important piece. If you're a member of the AANP, or the American Association of Naturopathic Physicians, you will have to have been through one of those schools and those programs and passed your board exams. So you know that those graduates or those providers in that directory will definitely have adequate training to help you from the initial point. If you want a more specialty organization or a specialist like myself who's certified in what's called naturopathic oncology. Now, I'm not an oncologist and I'm not claiming to be one. It's just that I look at naturopathic interventions that are focused specifically in the oncology setting. So there is an organization that's called the ONC-ANP. That's ONC-ANP, and that stands for the Oncology Association of Naturopathic Physicians. So a lot of times physicians, whether in their primary care practice or their community-based practices who aren't specialized in cancer care, will join this organization so that they can go and get some information from folks that are like me and other folks on the board and other avenues and resources that allow them to help cancer patients. But for the most part, the AANP is a good place to start initially. And then the second place for more specific cancer care is looking at the ONC-ANP, the Oncology Association of Naturopathic Physicians. And there you may find board-certified naturopathic oncologists, or you just may find folks that have additional training but haven't been board-certified yet.
Mm-hmm. Great.
Yeah.
For the providers in our audience, What would you recommend is the best way for them to kind of get up to speed with the kinds of assistance you offer patients?
Yeah, I think probably the biggest thing to do is to look into a conversation or reaching out in the community if you have patients with these needs. And it's interesting because the data does show that patients undergoing cancer treatment, up to 90% of those patients are using complementary or integrative therapies, and as a result, having a resource in your community or at least in your area where you can refer to, I think number one is great. And one of the things when I work in the integrative setting, that's one of the physicians, the medical oncologists, the radiation oncologists, the surgical oncologists really enjoy having someone like me around because they can have their patients answer those questions answered for their patients. Otherwise, it's difficult because to be able to review the literature and look at the different mechanisms of action of the different herbs and botanicals, nutrients, minerals, vitamins, other types of things is very time limiting, and it can be difficult for physicians to be able to dedicate that time to it. So I do believe that if you're able to, reaching out to someone with expertise has been trained and educated in those modalities to be able to help your patients and develop that relationship. When I teach oncology, the didactic class, I do talk with my students. I say, whose responsibility is it? Is it the medical oncology responsibility to be able to be experts in this area? And I don't think that's feasible. I think you can have interest there, and there are some providers that definitely have seen many of these things and looked them up, whether that's through PubMed or had other ways of looking into them. But nonetheless, I think that having an individual that has the training and the expertise and the understanding of cancer, all the way from carcinogenesis to interactions with treatment and different modalities and how they work, is key.
Great. Any types of questions that you might suggest that folks who finish their treatment or living with metastatic disease could kind of ask themselves to deduce, whether naturopathic medicine would be helpful for them?
Yeah, it's a great question. I always talk to my patients about values. So what I like to talk about is, for example, if you come to my office and you're not interested in making some dietary changes, or you might not be interested in taking any more pills, or, because some of the things I recommend might include those. And I think if you're not in a place where you're sort of like, if that's an interest or a value of yours, and that's okay. The difficult part here is I just want to set patients up for success. And so the questions I ask is, just because you go see a naturopath doesn't mean you're going to get a grocery bag full of supplements to take, and doesn't necessarily mean that you're going to have to go on some crazy modified dietary regimen. Yet, I think if those thoughts are in your mind and those questions are in your mind, it's helpful to go see someone to understand a little bit more behind the research or the rationale behind them. Yet I can honestly say when I was in the hospital setting in the Chicagoland area, the hospitals I worked at, there were some patients that were not interested in some of the pieces that we had to offer, and that's okay. And my goal there was to support them, of course, and answer their questions if in fact they had any sort of pieces. But that can include some, it doesn't even have to be regarding oncology specific. We could be looking at the healthy bone structure, right? What's the osteoporosis or osteopenia, and dietary interventions to making sure people are getting adequate forms of food in their diet so that they can live a healthy life in that regard. So I think the question really to me that I always go back to with my patients is saying, like, how does this fit for you? Is this something you're interested in? And you might not be interested in all of it. You could say, well, hey, I'm willing to do two things. Well, okay, we could pick those two things and strategize a plan that works for the patient to help, again, set them up for success. And if they're having success with those interventions, then they may decide to continue with additional interventions if in fact they want to. I think the challenge comes in with some of these things is that unfortunately a lot of and I'm not here to talk about this necessarily in terms of the aspect of it, but the things, the supplements, the over-the-counter type things, even though you can use them in a therapeutic sense, your insurance company is not going to cover those. And so a lot of times we have to ask and look at out-of-pocket expenses and how can we strategize using the diet and those interventions to help people, as opposed to having to spend a pile of money on a bunch of supplements that can be challenging. It's that's another piece of it. So creating strategies and plans for patients, I think the number one thing we should that I want my patients to understand and ask is, how does this fit into their overall plan? And then we can decide and sort of cut out what are the pieces and what it looks like and implement it properly. Yeah.
Yeah, great. Okay. So it sounds like I heard you say that, it's kind of almost an interview situation where the patient is going to interview the provider and
Yeah.
find out what's possible, what
Correct.
they might want to participate in, and then investigate, the out-of-pocket expense that might be incurred.
Yeah, and for some of those things, like, it might not be, it might be an acupuncture prescription, or, if we're looking at neuropathy or these types of things, we might be doing a trial of acupuncture, and that's, as long as their benefit plan covers that sort of thing, or what have you, or they're able to have some resources to be able to cover some of those costs, that could be a great intervention to help support them in their recovery or within their symptom management.
Mhm. Super.
Yeah.
So I'm going to post links to the websites that you mentioned
Great.
along with this interview. Any other resources that we should be aware of that we could also post?
Yeah, I think there's a few books. I mean, there's a book, one of the books that I really like to refer patients to is, there's a great book that's called Anti-Cancer, and it's a small read. It was written by a physician, a medical doctor. I'm pretty sure that, I don't know if he was an MD or a DO, but nonetheless, he had a brain tumor, and he had passed from his brain tumor, but nonetheless, he wrote this really neat book, and it has a really nice midsection in the book. It's very thin, but it's got a nice midsection in there that goes over some nice dietary recommendations that are really helpful for patients. I think that's a nice little easy book. So that's a nice book to read. The other book that I like is there's a book by Andy Weil and Don Abrams. It's called Integrative Oncology. It's a little bit more geared toward the clinical sort of implementation of these types of things, but it does have some general notions, and it's written by very, there's different chapters that are written by well-respected people in the field. And it's a nice book that sort of starts to bring up the conversation of what does integrative oncology look like, and how can you use it as a tool in your recovery and or remission and survivorship. Yeah.
Terrific. Any last words for our fans?
Yeah, no, I mean, I wish everybody, all the best, and I look forward to working with people. And again, if you're having questions or you need some input in your community, please reach out. And I think that there's a great opportunity for naturopathy, acupuncture, these types of modalities in the integrative setting, especially post-treatment.
Fantastic. Thank you so much, Dr. Peterson.
Thanks you, Meredith.